Okay, hi, we're going to talk about why you probably have abdominal syndrome. Most middle-aged and older persons in this country have abdominal pressure syndrome. The abdomen is a compartment. It's a compartment, above your lower extremity, your legs, and below your thoracic cavity. When a person's got big fat belly, it's harder to lower the diaphragm and they can decrease ventilation in their lungs. It's called Pickwick syndrome. Pickwick syndrome is from the book by Charles Dickens about 1830s, and it means hypoventilation due to decreased ability to lower the diaphragm. Typical example is a fat person, shorter breath from just walking up a couple stairs. The first symptom typically noticed with abdominal pressure syndrome is constipation. So if you're constipated, you probably got abdominal pressure syndrome. How often should you defecate? You should normally defecate at least twice a day and at least 3 times on a weekend. Ideally on a weekend. Why do you defecate more on a weekend? Because you're less stressed out. You're more in a parasympathetic autonomic nervous system phase, and then that's more of a feed and breed, rest and digest type phase. So your intestinal motility is increased and you defecate more often. What's normal poop look like? A normal defecation should look like a cow patty. It should be pretty soft, okay? If it's coming out looking like a Tootsie Roll, you're constipated. All right, what happens when you're constipated? Valsalva maneuver is to tighten up your abdominal muscles to try to pop one out down below. And that increases pressure in your abdomen. It increases back pressure on your sigmoid colon, and that produces diverticulosis. Diverticulosis means outpouchings, typically of the sigmoid colon. And by the way, what does the sigmoid colon look like? Your bowel looks like a question mark. So imagine here, I'm going to draw a little question mark here. That's a piece of poop coming out of your bowel. Here's your rectum. Here's your sigmoid colon, left colon, transverse colon, right colon, okay, like a question mark. So you typically get diverticuli in what's called the sigmoid colon. Those will sometimes pop. When a sigmoid colon diverticulum pops, that's called diverticulitis. Very painful, very common cause of admission to hospitals. Very common cause of a patient needing to go for surgery to resect the sigmoid colon, sigmoidectomy. Okay, what's the main cause of abdominal pressure syndrome? Lack of dietary fiber. Most people are not eating enough dietary fiber. You should every day be eating at least 45 grams of fiber, preferably a lot more than that. I think normal humans are designed to eat about 100 grams of fiber. All right, appendicitis. What happens is fiber pulls liquid into your stool, and it makes your stool softer. And it makes your stool kind of liquefied on the right side of the colon. You want that, because if your stool is dried out on the right side of the colon, like in the typical meat eater who doesn't eat hardly any plants, it'll have an increased tendency to form a appendical lith. Lith means stone. An appendical lith is dried feces in the appendix forming a rock in there that can become obstructive. And then the distal lower, let's say this is your appendix, a little black part of this pointer. The glands beneath, and let's say the appendical lith is like my hand right here. The glands beneath it will keep making secretions, and then the appendix will become distended until it pops. All right, that's appendicitis, perforated appendicitis. Not good. Even if it gets fixed surgically, you still might have adhesions, abdominal pain the rest of your life, and bowel obstructions. All right. What else? Dennis Burkitt. Dennis Burkitt, physician. He's a physician from Ireland. He was then a missionary doctor, surgeon in Africa, and he sort of developed the epidemiology mapping of a famous tumor that got named after him, the Burkitt's lymphoma. This guy's a real heroic guy. It's worth your time to study Dennis Burkitt's life. And he's the guy who mapped out abdominal pressure syndrome. What he basically saw was the rich people eating the modern diets like the English diet, a lot of tea and refined flour and jam. They had a tendency to be obese, and they got all these colonic and abdominal pressure problems, versus the people eating, the more rural persons eating plant-based diets, a lot of sweet potatoes and rice. They had virtually none of this abdominal pressure syndrome. Okay, and what does that mean? He said, working there, Dennis Burkitt said, in 20 years working in an area that has a plant-based diet community, he only had to do 1 gallbladder surgery. Gallbladder surgery is super common. Gallstones are super common in people who eat junk food and meat. Excuse me. All right, what else to know? Also, colon cancer is much more common in meat eaters, especially red meat. What else? Straining at the stool, the increased abdominal pressure pushes down in the leg veins, causes varicose veins, all these leg veins. Women like it when you tell them like that. They're kind of surprised. It's a useful thing to know. So being constipated increases your incidence of varicose veins in the leg, because you're creating increased pressure on your cava, harder for that blood to come up into the abdomen. You're also getting increased pressure down into the scrotum. So men get dilated veins in the scrotum. It causes a varicocele. That can be painful, can cause chronic aching discomfort. It can also cause infertility. You also get increased hernia, swelling of the veins in the rectum area. Okay, those are called hemorrhoids. You get increased hernias, things when the abdominal cavity is constantly under pressure from straining at the stool. You get hernias popping down into your inguinal area, to your groin area. Those are called inguinal hernias. Very common location for hernia. Also, your stomach pressing down, there's increased pressure in your stomach. Your stomach will pop up into your chest. That's called hiatal hernia because it passes up through the diaphragmatic hiatus. Okay, and then you'll have increased tendency to get reflux of stomach acid, gastric acid. That's called GERD, gastroesophageal reflux disease. When you got constant gastroesophageal reflux into a hiatal hernia, the tissue on the esophageal wall at that location and the hiatal hernia wall becomes inflamed. That's called Barrett's esophagus, and that has a markedly increased incidence of forming esophageal carcinoma. As a matter of fact, esophageal cancer has changed. Back when I was in training, it used to be talk about smoker-drinker cancer, you know, smoking cigarettes, drinking alcohol, and you get squamous cell carcinoma. Nowadays, it's more common to get adenocarcinomas from this reflux hiatal hernia. There's so many more fat people with hiatal hernias and gastroesophageal reflux. Plus, these patients have increased incidence of becoming demented. It's not good. You don't want abdominal pressure syndrome. It seems like a big joke here. We're talking about all this stuff about defecating and stuff, but it leads you to all these additional problems. So, how can you minimize your risk of abdominal pressure syndrome? Eat more fiber. Every plant has got a lot of fiber in it. The reason is a plant cell wall is stabilized by fiber. Other name for fiber is cellulose. Okay? So there's always reasonable amount of fiber in plants. Always. That's by definition what plants are. And the fiber does a lot of other good things too. It feeds the good gut bacteria, decreases your risk of leaky gut and all that stuff. But you want to eat more plant foods. So that's the key thing to know. The best plant food to eat is starch. Let me show you what starch is. You know, sometimes I say starch and people don't know what I'm talking about. Starch is basically primarily a polymer of glucose, meaning a bunch of glucose molecules in comparison with other types of carbohydrates like fructose, and especially industrial, which is common in fruits. Here's a bunch of rice, okay? Rice is like a polymer of glucose. It's really good for you. The thing about rice is it's like a branch chain. Let's say you got different branches sticking out all over the place. So the digestive enzymes can digest it pretty fast, but it's still really good for you. That's in comparison, for example, here's some beans. These are both starches. So starches means, what starch basically means is a plant food that is primarily a polymer of glucose, meaning a bunch of glucose molecules stuck together, and it's encased in fiber. The fiber is great because it makes it low caloric density, stretches your stomach, causing early satisfaction of hunger, early satiety, and it slows down absorption from the intestinal tract into the bloodstream such that you get a slow increase in blood glucose. So your blood glucose stays normal a prolonged amount of time and you feel good. The unique thing about beans is the starch polymer of glucose in beans is a relatively straight line with just two ends, meaning that an enzyme can only grab onto those two ends. So it takes longer for the digestive enzymes to break apart the individual glucose molecules in a starch that comes from beans. That's why beans satisfy hunger for such a prolonged amount of time. It's called the second meal effect. You can eat, I know from experience, I eat beans for breakfast. I don't even need to eat lunch. I can not eat again until 9 o'clock at night and be fine. So they help you to lose weight. Beans got a lot of protein in them though. If you're like, let's say you're a mild kidney failure patient, you want to be careful with the beans because they got significantly more protein than other plant foods. But beans are great food. These are like garbanzo beans, really good. The smaller beans probably got a little more fiber in them, like a lentil bean or something. They're both really good starches. Here's some other starches. Here's oatmeal. Plain oatmeal, and it should be cooked in water. Not in milk, not anything else. Plain. And I don't like all the fancy oatmeals. I don't like the flavored oatmeals because then they start putting MSG in them and who knows what else. This is plain. There's nothing in here but oats, and actually I'd probably be better off with steel cut oats or something because it's going to have a little more fiber, less processed. But there should be nothing but oats in there. Look at the ingredients, you know, there's 0 sodium. That's what I want. I don't want any sodium in my food. All right, here's quinoa, another good starch. So anyways, those are examples of starches. Plant foods that are polymers of glucose encased in fiber so that they satisfy your hunger with the fewest number of calories, that optimizes your body weight. All that fiber keeps you nice and regular downstairs, and you avoid all the abdominal problems we spoke about here.